new healthcare coverage. Number one, it will provide you with a number of personalized plan options that you can tailor from. Number two, the plan is the same quality as the plan you have right now, but it may actually save you some money. And finally, and number three, it simplifies the administration while providing you more choice and more control. Before making this change, we carefully reviewed our options and chose Extend Health as a partner for their excellent reputation in this marketplace, and in particular for their personalized one-on-one counseling approach. Now, I'm going to turn the meeting over to Extend Health. They're the experts, and they're going to cover with you all of the plan details, what's going to happen next, and what your role in this change is. But before I close off, I'd like to remind you that we're very proud of the coverage that we provide our retirees. We want that coverage to continue. We want the quality to be the same, and we're very excited about this change being an opportunity for you. I look forward to hearing from you and your feedback about the changes we're introducing into this plan, and I wish you a productive meeting with Extend Health. Thank you very much.
I would like to thank you all for joining me. My name is Catherine Hines, and I'm with Extend Health, and I'll be telling you a little bit more about how this is going to work. Who is Extend Health? We are an independent company. We are not an insurance carrier. So you will not be purchasing Extend Health insurance. How many of you listening to my voice would be interested in having an expert in your corner in Medicare? That is exactly what Extend Health is. We are your expert in your corner, your benefit advisors, or your advocates, here to help you navigate the Medicare market. We work with over 75 different carriers to make sure we get the option that is best suited for you. This obviously is not our first time around the block, and so we'll help you make a comfortable and confident decision. We have worked with nearly 500,000 retirees just like yourself going through this process. So this service is provided at no cost to you. So you don't need to be worried about what it will cost to work with your advocate or your benefit advisor, because it is at no cost to you, free. Now, we have worked with multiple companies like your own in going through this transition. So you may be familiar with some of these names like Kellogg, Ford, Caterpillar, Avon. That's, of course, my favorite, just to name a few of those. Some of you may also be concerned that this may be a complicated process. I want you to rest assured, you can be comfortable that we will make sure we answer all of your questions and that you understand this process. So first off, if you were to pick up a piece of paper and draw a line directly down the middle, on one side you'd write Medicare Advantage. On the other side you'd write Medigap. It will either be a Medicare Advantage plan or a Medigap. It's that simple. It'll be one or the other. Now, if you select a Medigap plan, you will add Part D. D stands for drug. In this situation, almost as if the government did make something simple. And you would have a Part D with your Medigap plan. The Advantage plan generally already has that built into it. Now, the companies or the carriers that you will be working with are also names that you're going to be comfortable with. Names like AARP, United Health, or Blue Cross Blue Shield, Humana, just to name a few of the carriers. And we do have vision and dental options also available to you. Let's take a closer look at what a Medigap plan is. What can you expect and how do these work? Medigap plans are nationwide coverage, no network, and nearly all doctors and hospitals across the U.S. accept them. So these types of plans work very well for someone who has a home in 2 states, or if you travel a lot. Or another example, if you have high medical needs, a Medigap plan may be suited for you. Now with that, as you would add, you put a plus sign and put Part D, or your prescription drug plan. So you'll have 2 independent plans together. If you select a Medigap plan, you will be paying your premium at time of enrollment. So you need to anticipate that for your budget. So if you select Medigap, you'll make your premium payment when you enroll. Your Medicare Advantage plans are plans that you're also familiar with. They're your HMOs and your PPOs. Your HMOs are your health maintenance organizations, or your PPO, preferred provider organization. An HMO, you have to use their doctors or facilities, or you have no coverage outside that HMO. Your PPO is a preferred provider organization, so you have in and out-of-network coverage. Your in-network will cost less than your out-of-network coverage. You have deductibles and co-pays also associated with these networks. So that's your Advantage plans. We kind of call them your pay-as-you-go because your premiums generally can be less, but you have co-pays and deductibles associated with that. Now let's walk through this process. First, we're going to go through an education process. And the biggest part of that education process is not when we answer your questions about how does Medicare work and make sure that you understand all this. The biggest education process is what you put your benefit advisor through, them finding out what your needs are. Because as we know, your neighbors, Mr. and Mrs. Smith, may not have the same prescriptions and may not have the same medical needs. Therefore, they may need two individual plans. So we're going to make sure that the plan is suited for you and the prescriptions that you take and the doctors that you see. So that's the biggest education, is what you help your benefit advisor find out about you, helping you select that plan. After we help you select a plan and go through that evaluation, we don't just tell you, oh, go enroll with this company, that's the best one for you. We do that enrollment for you right over the phone. And then we continue to manage and monitor your health care needs going forward so that we're always here for you because, as you know, from time to time, Medicare makes changes, and we want to make sure that we're there for you to help you manage and monitor your health care needs going forward. You will have received a Getting Started guide, and it's basically going to ask you to gather your prescription drugs together, write down your doctor's information. It has, of course, our toll-free number on that, which is 855-535-7140. And it also has our website address available to you. We want you to know that as you read through this information, and it's going to be the same information we're going over today, that you do not need to worry or concern yourself with any pre-existing conditions. At this time, you have what we jokingly in the industry call the golden ticket opportunity. You have guaranteed issue, which means that no pre-existing conditions are going to stop you from getting the plans that you wish. Now, if you have end-stage renal disease, you still have multiple options available to you, and you need to let your benefit advisor know so that they can take the best care of that. But other than that, you do not need to worry about any pre-existing conditions. Now, you will also receive, after the Getting Started guide, an enrollment guide. Basically, it's going to remind you of your appointment that you've made, because you're going to call in and make an appointment to speak to your benefit advisor, and prepare you for the review and questions that you may have about this process. Let's say you call, you make your appointment, then you find out that your granddaughter has a piano recital. Or, as in my case, I've actually had some of my retirees call and say, Catherine, it's too beautiful a day. I have to go golfing. No problem. You can change your appointment or call in when you're available, and we'll get you taken care of. Now, there are many support tools available to you, so if there are people in the audience that like to browse the internet, we have some tools available to you. For those of you that do not like to, don't worry, you never have to touch it. But for those that you do, you can go to our website, enter in a little bit of your information and your prescription drugs, and take a look at all the different plans that are available to you and the details of those plans in your zip code area. Now, let me give you that website address. It is www.extendhealth.com/DuPont.